Occupational therapist Jamie has been working with Elsa after a car accident left her struggling to use her left hand. After talking to Elsa's family, Jamie learned Elsa's birthday was coming up, which meant there would be presents for Elsa to open. Jamie has been focusing on performance skills aimed at preparing Elsa to open her own gifts. It is now Elsa's birthday, and Jamie is there to celebrate with Elsa and her family. So, what core concept was just demonstrated? I'll give you a clue. As you can see, the client-centered approach is very important in the therapeutic process. Physical and social environment is also very important. Choosing an environment that is familiar and comfortable to your patient will help in their success. Now let me introduce you to occupational therapist Cindy and her client Brian. Brian recently had a skiing accident that landed him in the hospital. Since then, occupational therapist Cindy has been working with Brian on rebuilding strength in the leg he had surgery on. Since Brian is a track star and state wrestler, Cindy knows how important it is to him to get back into sports. Let's look at what core concept was just demonstrated. It's easy to see why participation is essential to one's well-being. Cindy chose activities that motivated Brian and kept his interest. Next up, we have occupational therapist Mallory and her client Beverly. Occupational therapist Mallory's client, Beverly, is suffering from arthritis and Alzheimer's. Beverly voiced to Mallory that she could no longer participate in her favorite hobby, knitting. Mallory has been working with Beverly on not only joint mobility, but also mental functions. Today, Beverly is doing great, knitting a sweatshirt for her granddaughter. So, what core concept was just demonstrated? That's right. The person as a whole, so the intervention plan should address both their physical and mental needs. Mallory just demonstrated this by not only working with Beverly on the physical part of knitting, but also the mental part. In addition, Mallory did a great job of identifying and working with Beverly on her leisure occupation, knitting. Here we have occupational therapist Stanley and his client Becca. Stanley's client Becca has cerebral palsy. Recently, Becca has shown interest in getting her own apartment and becoming more independent. Stanley has been working with Becca on activities of daily living, such as personal hygiene and grooming. He has also been working with Becca on instrumental activities of daily living, such as meal preparation and shopping. Let's see which core concept was just demonstrated. Occupations are influenced by the individual roles. This example demonstrated occupational performance as Brian worked with Becca on activities of daily living and instrumental activities of daily living. Here we have occupational therapist Brandy and her client Jim. Jim has been struggling to return to everyday life after a motorcycle accident left him a paraplegic. After an initial assessment, occupational therapist Brandy realized the need for occupational therapy interventions. Occupational therapist Brandy is now modifying Jim's apartment to make it more wheelchair friendly. She is also working with Jim on using assistive technology. core concept just demonstrated was: as you just saw, every human has the ability to change. Brandy is helping Jim adapt using occupational therapy interventions such as assistive technology and environmental modifications. Here we have occupational therapist Jody and her client Jake. Occupational therapist Jody's client Jake has difficulty socializing with his peers. Jody knows Jake loves to watch soccer, so she has arranged for him to play a game. She is so excited, but when she tells Jake, she is met with disapproval. Jody doesn't want to force Jake, so she asks him if he'd rather go to the park. Jake lets Jody know that's what he wants to do. They go to the park, and after a couple minutes, Jake is asked by a player to join the game. Jake agrees and joins the soccer game. Let's look at the core concept just demonstrated. Secularism, equality, freedom, justice, dignity, truth, and prudence are the core values of occupational therapy. As you saw, Judy didn't get mad or frustrated with Jake when he didn't want to participate in their soccer game she had arranged. Instead, she gave him the freedom to choose something different. Jake playing interactively with peers showed an improvement outcome. This is occupational therapist Chris and his client Addie. Occupational therapist Chris's client Addie is falling behind on her developmental skills. Currently, Chris is working with Addie on crawling. During Chris's initial observation of Addie, he noted her delight over the sound a rubber duck made. Chris is using the rubber duck to encourage Addie to crawl. What core concept was this an example of? As you just saw, humans learn through thinking, feeling, and doing. This example demonstrated functional mobility as Addie was learning to crawl. This is occupational therapist Derek and his client Mary. Mary had a stroke which left her with left side weakness. Derek has been working with Mary on preparatory activities and exercises to prepare Mary to go back to her role as mother. Today is Mary's last therapy session as she has completed all of her goals. Let's look at the core concept just demonstrated. Occupation can be used as a means to bring about change in the client's performance and as an end in achieving the desired outcome. The occupational therapy practice framework demonstrated was outcomes, role competence. As we saw at the end, Mary was able to successfully return to her role as mother.